Influenza or flu. It is a viral disease produced by virus A, B, and C, and it is an airborne infection that spreads through droplet and aerosols. The infected person exits the virus of the influenza or flu by coughing, sneezing, talking, spitting in the locality where he is residing. So the person within limit of 1 to 2 meters may suffer from infection of the virus, that is influenza virus attack. It passes from mouth and nasal cavity, infecting the epithelial layer of the nasal cavity and pharynx, that is the throat, and in the upper respiratory tract infection that produces inflammation due to the reaction of the immune system of the body and produces the symptoms which are very troublesome and panicky for the patient. Though it is a curable disease or infection which is cured on its own within 1 to 2 weeks by proper care, symptomatic treatment, rest, and the healthy diet. The various symptoms produced after the infection of the virus almost 2 to 3 days, which is called as incubation period. The symptoms appears, that is fever, chills, runny, stuffy nose, hoarseness. Then there is trouble, some respiration, that is restlessness and breathlessness, which is called as dyspnea, myalgia, malaise, loss of appetite, arthralgia. Then it may cause also palpitation, cyanosis. Then there is hypoxemia and hypercapnia because the respiratory system is disturbed by the airways inflammation. That is, it mostly affects the upper respiratory tract, which consists of the airways, that is bronchioles, the air pipes, which, through which the fresh air passes, and the contaminated air that is consists of carbon dioxide is getting out of the body. So it produces hindrance and the disturbance in the process of respiration. Now the diagnosis of influenza. First is a physical examination and the history of the patient, which is quite evident. That is, there is coughing, there is sneezing, there is fever, body aches, headaches. These are the main symptoms narrated by the patient. So the swab of the nasal secretion mucus is sent to the laboratory for examination of the strains, that is virus A, B, and C. Next is the detection of the antibodies in the blood by taking samples of the blood and sent to the laboratory so that we can judge or we can estimate the level of the antibodies produced by the immune system against the virus. Then is the PCR test, which is a very important and very reliable test one. And then is rapid virus antigen test. That is, the presence of the virus in the blood is detected by these laboratory tests. Complications of the influenza. Mostly it is a disease of the or infection of the upper respiratory tract and the throat and the nasal cavity. So the complaints or the symptoms, they are pertaining to the nasal cavity throat, hoarseness, the pharyngitis, nasal stuffiness, runny nose, and the upper respiratory tract. That inflammation produces disturbance or difficulty in exit and inlet of the air, in the airways, the air pipes of the respiratory tract. So these, if it is mild to moderate degree of influenza, it can be cured by simple domestic treatment. The symptomatic treatment and the rest and the adequate, the hydration and the isolation of the patient. But if it is a severe one, it is prolonged one beyond 2 weeks, then we have to be serious in the treatment of the patient. The antiviral treatment and other along the other symptomatic treatment they are given. So to avoid the complication, that is the upper respiratory tract infection of the virus may passes down into the lung parenchyma, and that produces inflammation, irritation, which may lead to the pneumonia, COPDs, asthma, bronchitis, emphysema, and prolonged infection may lead to the TB and the lung carcinoma. So these are the complication of the influenza. If it is a prolonged one or it is of severe category, so that may produce the complication and the critical situation, which we have to admit the patient in the hospital for ventilation, or may patient need ventilators to maintain the respiratory system and the oxygen level and demand of the body in the blood.